what about like different stages in pregnancy?
Mm-hmm. Yep.
What are different things that women can assess? Like, I'm uncomfortable, I'm in pain, like what changes in the body? As a physical therapist specializing in pregnancy, what would you say per stage?
Yeah, that's a great question. So I would say for the first trimester, we tend to try to keep our goals very realistic. First trimester can be brutal for a lot of women. I mean, the nausea, the fatigue, just those two. Like, let's say you just have those two symptoms alone. Getting through a work day and feeding yourself dinner can be all that you can manage. So for those women who are going through their first trimester, we really focus on being upright. And I know that sounds like a low-grade goal, but it's true. Because if we recline, every day that you're on bed rest, you could lose muscle mass. Up to the point where if you're on bed rest for a whole week, you could measure a 12% muscle mass loss.
What?
That means like you have, say, thick quad muscles, and you could measure it visibly with an ultrasound, and then you measure it again a week later, and there's less of a quad muscle. Like those fibers have gotten smaller. That's a problem. So we want to make sure that you don't lose muscle mass and you don't lose range of motion.
Okay.
So we would prescribe something really simple like arm mobility and sitting. We would give you a seated stretching program, or maybe something to do in a laying down position. Some of our moms in first trimester prefer to be propped up on a wedge. That can help with nausea, or even reflux can be really strong at that time.
Yeah. Tell me about it.
I know, right? Oh, I had reflux with both.
I didn't have reflux. I was just throwing up every
Where are you?
flipping day.
Yeah. That's
For the 3
awful.
pregnancies,
All
for the
3?
first 3 months, it was so painful.
That's brutal.
I know some of my friends threw up the whole pregnancy.
Mm-hmm. I've heard of that.
I felt lucky after that. I was like,
Right?
I woke up
Yeah.
great.
Yeah.
But not
I actually never threw up, but I just felt gross for the whole first 3 months. Like, don't look at me, don't touch me, I don't want food, I don't want this. Like, everything was gross.
I don't know how many women can identify, but I would tell my husband, like in this subject, I would tell him, I'm hungry, but I don't know what to eat.
Oh,
and
yeah.
I think of food and I want to throw up.
Uh-huh.
Oh, Perso, he was just like, I don't know what to bring to you.
Right.
I don't want to make you suffer.
Uh-huh. Like, where do I go from here? Yeah.
And the first pregnancy, he's like, you don't want to eat. You're going to hurt the baby. Until the doctor was like, that's normal. She's not going to want to eat. It was just brutal. Just the part of like the nauseous. Okay.
Yeah.
Second trimester.
Yes. Okay. So second trimester should be where you get your second wind. And we just acknowledged there are women who don't, and Godspeed, because that's really tough. However, the majority of women, as they go into their second trimester, they have less fatigue and less or no nausea reported. Amazing. The thing is, they then are like, oh my gosh, am I sort of myself? Let me spring back into the gym. I need to go for a run. Pilates, here we come. And they unintentionally overlook any tightness or weakness that they may have earned from surviving their first trimester. So that is why at Painless Pregnancy, we really want to assess you as early as possible. So in that first trimester, even if you're feeling better in your second trimester, this would be a great time to start working out. But what specific tip I would give, if you're in the second trimester and you want to start exercising, but you know you were really inactive for the first trimester, I would say do your same workout routine and turn down the intensity by 50%. So if you're a runner,
Okay.
and you normally run 3 miles, that's your routine, go for a run, but run 1.5 miles.
Okay.
Or if you're a weightlifter and you have your strengthening routine, arms, legs, core, all of it, do that routine you used to do, but bring your weights or your reps down by 50%. Just for the first 1 or 2 workouts. Then you can give your body that space, that time to readjust. And if it works, amazing. You have that normal soreness for a day or 2 after. You can transition and slowly increase your weights, your reps, or your mileage. But I would really strongly recommend not jumping back into exactly what you did 3 months prior.
I remember my belly was so big, like
Yeah.
even moving Like sleeping in one side, it was like take the belly,
Uh-huh.
move it a little bit, and throw it to
Oh
the
my
bed
goodness.
so you can.
Did you? Oh my
It was
goodness.
so big, I couldn't close.
Yeah.
So I would be like 1, 2,
Oh my
3,
goodness, Diana.
going to the other side. I swear. I'm a
That's
tiny
wild.
woman, but like
Yeah.
my bellies were huge.
Yeah, that's wild.
So what would you say?
It's so interesting you say that because, you know, I remember when I was studying in obstetrics and you take your first class and you're like, so am I an expert? Like, can I do this? And your teachers, your mentors are like, yes, go treat pregnant women. Like, do the things. You'll learn as you go. I'm here to support. And I remember like teaching core engagement is like PT 101. You do that for any person who's ever had back pain or postural issues. We teach them how to activate their deep core. So I had a patient, one of my first home health patients, and she was 3rd trimester, maybe 36 weeks along, really distended belly. She had a Ehlers-Danlos diagnosis, which means her soft tissue would just stretch and stretch and stretch. She was like a Gumby kind of
Probably me.
physicality. And so one of the things I taught her, I think she was in bed when I got there because she just couldn't get out. So her husband let me in. I go up the stairs and she's telling me what's going on. I'm like, great, let's just start here. I want you to exhale and hug your baby towards your heart with your stomach muscles. And she did it. And I said, okay, now roll onto your back. And she rolls onto her back and she looks at me and she's like it was magic. And Diana, it's the simplest, most standard physical therapy tool. And that helped her tremendously. Like I remember she did a Facebook review and talking about, and I could roll without pain. And I was like, I hadn't even touched you yet. I just like taught you how to connect to your core and you could do that. And so, you know, when I talk to the other therapists that I'm honored to work with, and you know, we get obsessed with all these like really cool techniques and like mobilizing the sacrum and lifting the bladder. And I'm like, great, we're going to learn all the really specialized techniques. And don't ever forget about the basics. Like sometimes you are going to teach her how to activate her core and you will be her superhero for the rest of her pregnancy.
It's incredible how simple things can make, like breathing or like hug, they can make such a huge difference.